Computer, yeah.
So,
Okay, over to you, Bob. Thanks for coming.
My pleasure. Thanks for inviting me, Dave. I think it'd be useful just to recap what the problems the NHS faces and what, if any, the change of government has addressed. Um, just to sum up, we have an NHS now which has essentially been reduced to a logo and a funding stream. And when I've spoken before, I've explained how successive legislation has totally repurposed the NHS. The last bit of legislation having gone through in July 2022, effectively creating American style integrated care systems based on managed care. And this is a system devised by the insurance industry back in the 70s in America, and it suits their interests. None of the reforms have been designed to spend money more efficiently or to serve the public and the patients or look after the staff. So we have an NHS which is very dysfunctional. A large part of the budget is going out in overheads, such as um, paying for the bloated bureaucracy. It's also going out in servicing private finance initiative debt. And it's also going out in these contracts, very lucrative contracts with the private sector, who are allowed to cherry pick straightforward, profitable cases, leaving the expensive stuff in the hands of the NHS. So the infrastructure of the NHS, the land, the buildings, the number of beds has declined by around 50% since the peak in the 1980s. We've seen over a decade of uh, austerity in terms of staff wages. There's been an erosion in the terms and conditions. We have a chronically understaffed, overworked uh, NHS workforce. And there was some hope amongst people that somehow a change in government might cause a change in direction. Um, People such as myself were highly skeptical of that, but you hold on to a glimmer of optimism. So what's changed? Well, when we had our election in July, the junior doctors were still in dispute with the government, and what Labour have done is agreed a settlement. But what the settlement actually is doesn't take the junior doctors to where they wanted to go, but they've took a pragmatic step and say, well, let's bank the gains and we live to fight another day. So they didn't get what they wanted. There continues to be a significant brain drain of medics out of the NHS. And we have this manufactured crisis of opportunity for doctors within the NHS. For example, in nearly every speciality, after a junior doctor completes their 2-year stint in hospital, they have to make a decision where to specialize. And for every speciality, they are oversubscribed. And what does that mean? There are more doctors applying to do specialist training than there are places. Yet we are constantly told by politicians and the media that, oh, we're really sorry there aren't enough doctors. Well, they're choosing to restrict the number of training posts. So that hasn't changed. They haven't opened the taps in terms of turning it on and training up more doctors. In fact, what they've done is kept hold of the previous government policy of training a whole cadre of medical professionals, they call them, who can operate as a GP with 2 years training compared to 10 years training it takes to have a fully qualified doctor become a GP. So there is what is called downskilling and an active doctor substitution program being continued by the new Labour government. Now, this doctor substitution is going on in the face of growing GP unemployment. Now, I don't know about you guys, but most people are experiencing great difficulty accessing their general practice for appointments But now, a lot of the time, they're not being seen by a GP. They're seen by what are called physicians associates who have far less training. And the scope for medical error, misdiagnosis, delayed diagnosis is growing. So you have a manufactured crisis in the workforce, you have a downskilling agenda, and on top of that, we have and remain having inherited a deeply low capacity within the NHS. So we still have the problem of what is labeled corridor care, which is when sick and elderly people require a hospital bed, they languish in corridors. And we know for every 80 people waiting in corridors who should be on a specialist ward, for every 80, there is one preventable death. Now, there are tens of thousands of such patients across the country, and that is going on. And this should be a national scandal on the news all the time, but it isn't being covered. And when it is covered, it's being normalized. So we are getting used to hearing these headlines of the NHS struggling. And to cap it off, recently West Streeting announced, I think it coincided with another bit of major international news, that they would not be sticking to the Tory pledges of 40 new hospital builds. Now, we never believed those on face value to be brand new, totally complete hospitals. What they were dressing up as hospital building program was very often a refurbishment job or perhaps sticking on an extra wing to an existing hospital. But now Labour have said the finances don't allow for the capacity within the NHS hospitals to be fixed. Well, that's very convenient because unfortunately the cross-party consensus is to have an NHS which is failing, is to have people languishing on waiting lists for months and years, and is to have a demoralized workforce. Because what we see as problems are necessary ingredients to continue this transition to a skid row public service provision and an expanding private healthcare market. So a lot of these people waiting on lists will take the difficult choice to use up life savings to get an operation so their quality of life can improve. The people who are languishing on in corridors don't have such a choice because very often they're not in a fit state to be making other arrangements. They're very vulnerable and very often elderly and maybe unsupported. So these people are paying the price with their preventable suffering and sometimes with their lives. But this is the necessary lubricant, the collateral damage, if you may, which is required to totally destroy the faith in the system as we creep further and further to the dystopian American model. Now, interestingly, you may have heard of the news of the assassination of the CEO of United Health, America's biggest insurer. He was assassinated in New York by a young man called Luigi Manzioni. And it appears that his reason for doing so was that his actual medical care was damaged at the hands of United Health. So there is an ongoing case and investigation into what happened there. Now, what people weren't expecting was rather than a mass outcry on social media saying how horrific this killing was, in fact, the majority of views expressed were sympathy with the shooter and contempt for anybody involved in private healthcare in America, particularly United Health, who are known to have the highest rejection rate for medical claims when people are making them. When they come to need their insurance, they find that their access to being paid out for health cover is denied. And it appears that this Mr. Thompson was pushing through an algorithm which resulted in, I believe one figure was 90% of claims being rejected.
Jesus.
Now, United Health happens to be in the top 10 of the stock market in the US. This is a massive company generating tens of billions of dollars in profits, and the public really have had enough of this cartel of insurers and hospital providers who just see the patient as something to be fleeced. See, so perverse is the situation there that people are operated on when they don't need operations to generate profit for the hospitals. People don't receive insurance payouts when they need insurance payouts for valid reasons because the insurers want to keep the money to push up their profits. So the patients are totally at the mercy of competing interests, be it the hospital providers, be it the insurance companies, who increasingly control what the taxpayer funds, which are schemes like Medicare for the elderly and Medicaid for the young. These are publicly funded systems, but they are run through the hands of the insurance companies. And interestingly, one of the former senior executives within United Health was employed by government to run their Medicaid system. And a greater proportion of the profits for these insurers is coming from raiding Medicare public budgets. So, what I've outlined there is really, in summary, it's business as usual. We've had Keir Starmer openly in negotiations with people like Bill Gates, who's a sort of internet tycoon, but increasingly has his fingers in public health and international health pies. And also a gentleman called Larry Fink, who is the chief executive of BlackRock, which is the biggest, I believe, private equity fund controlling something of the order of $9 trillion worth of wealth, which they are looking for a place to invest. And healthcare, which delivers good dividends, is a prime target. And Keir Starmer has the ear of these people, and he will be doing as they request, which is to carry on with the disastrous transition to a full-blown marketized, publicly subsidized healthcare system, which is where we're at. And back to you.